so what is the most diagnostic point regarding acute pericarditis? Okay, so actually it is the inflammation of the pericardium. Everybody know. Okay, the most high yield point is this one. Okay, remember you are having sharp pain. Okay, even the pain history can tell you about if the pain is just burning pain. Okay, it will be not pericarditis. There are certain nature of the pain, burning pain, crushing pain, like that. Crushing, tearing pain is a feature of, in vertical dissection. Burning pain is a feature of your peptic ulcer disease. Okay, dull aching pain is a feature of myocardial infarction. And here you are having sharp pain. Okay, so I have described you the pain nature and different differential diagnosis. Guys, I am just talking about first aid. I'm not talking about other your clinical setting. Okay, so sorry for that. I'm just talking about first aid. Okay, in the first aid, the pain nature. Okay, then the most ideal point is it is aggravated by inspiration. Okay, when you ask the patient to inspire, normally patient is okay. When you ask the patient to inspire, when there's maximum inspiration, okay, patient will have pain. And most of the time, patient will take small breath. Patient can't take, deep inspiration due to pain. Okay, it is aggravated by inspiration. And next, the most high yield point is it is relieved by sitting up and leaning forward. Okay, so when patient takes spine position, pain aggravated, and then the patient is sitting up and leaning forward like that. Okay, so that pain will be relieved by leaning forward. And guys, remember this is the most ideal point. Okay, it can be complicated by pericardial effusion. Most of the time, it can go to cardiac tamponade too. Okay, and next important point is that you will have a friction rub on the pericardium. Okay, you will have scratchy sound like that. Like if you rub your two surfaces. Okay, so you will have a scratchy third sound. Not you have two sound, S1, S2. Also you will have third sound because the pericardium is inflamed. When heart will actually touch with that pericardium, you will have a scratching sound like that. Okay, so then there are two ECG findings. Okay, one is non-specific, one is specific. Okay, there are two ECG findings. One is ST segment elevation. Okay, which type of diffuse ST segment elevation? Okay, you will see in multiple leads. Okay, so remember widespread diffuse ST elevation. And guys, if you are thinking this is specific finding, that is a not case. Okay, remember this is not specific finding because it can occur in multiple other disorders. Like it can occur in aneurysm. Okay, but PR depression is specific finding. When examiner is asking about which ECG finding, so here is MCU. Which ECG finding is specific regarding pericarditis, which is a PR depression. Okay, this is specific finding. Okay. Yeah, remember, most of the time you will not see PR depression. Then there is another question. Which ECG finding is common? The answer is ST elevation. Now, okay, most of the time, actually, students comes to me, sir. Okay, I know the answer, but most of the time my answer is wrong. Okay, I am well in studying book. I am well, but I can't get 50% on your work. Actually, you have to understand the question. Whenever you are actually reading through the your question, remember three things. First of all, read the last line. Okay, point number one. Then see the age, gender, very important, and past medical history. There are 3 points students always miss on your word. First, you miss your gender, age, and past medical history. Very high yield. Whenever, okay, examiner is not just, okay, you can say as that is giving you a past medical history. Okay, there is always a reason. Whenever I see the medical history, I thought there should be a reason to give that history. For example, if the SL history is given and then you are having pericarditis, that will be pericarditis. If if CKD, we can say, end stage renal disease history is given, okay, and then you are having pericarditis, okay, then you are having a third murmur is given, okay, that will be urinary pericarditis. So, guys, please, okay, even it is your last, okay, lecture with me, remember, okay, see age, gender, past medical history. We morons always focus. Even when I was suffering in USM step 1, okay, in step 2, I realized my mistake. Okay, okay. So when I was preparing for business step 1, I I study more than, you can say, 18 hours a day. But I can't get my my imagine score, my dream score on NBME, on different assessment. Reason was that I missed those points. Then in USMLE Step 2 CK, I always get 260 plus on any assessment. Reason is that I learned how to do the UL question. So when the UL question is given, always start the, you can say, always start the last line. Then go the age, gender, past medical history, we always focus on the sign and symptom. We always focus on the diagnosis, okay? But examiner want to check your physiology, your okay question appreciation, okay? So always focus on that. So what are the causes? Surgery can be a cause, like if the patient is going under cabbage, okay, you can have pericarditis, connective tissue disorder, cardiovascular event, very important. When we study the MI, there are two types of pericarditis related to MI. So one is that will occur in acute, that is called post myocardial infarction pericarditis. So the other is that will occur in after month in Dressel syndrome. Dressel syndrome actually it is the autoimmune reaction. Okay, it will occur after MI after month. So that is Dressel syndrome. Okay, I'm not covering here. We will cover in the actually myocardial infarction lecture. Then there it can be predation, renal failure, idiopathic, the most common. It will occur after viral, okay, infection. Also, it can be due to anxiety. Anxiety can cause myocarditis or can cause pericarditis. What is the treatment of choice? NSAID. When you don't give NSAID in the urinary pericarditis. Also, you can give colchicine in rectal pericarditis.